morning, good afternoon, good evening, wherever you're joining from. Thanks for being here for the very last meeting of the WorldFAIR project's webinar series presenting our case studies and our project outputs, and the second last day of the project as well. So we're finishing up at the end of May. A quick housekeeping before we start. So we are recording, and the recording will be uploaded on our website and our YouTube channel. We had a very, very busy May, so we are working really hard to make sure everything is uploaded and disseminated for you. But the recording will be also sent to you via email after the meeting. So please post your questions in the chat during the presentation. There will be a Q&A section at the very end. And I will give a quick introduction about our speaker for today, Keith Tomlin, who is an assistant professor at the London School of Hygiene and Tropical Medicine. And Keith has been one of the work package leads for Work Package 7, the work package on population health, which focused on the definition of aligned standards, forming the basis of an AI-ready description of data suitable for cross-domain use. It also worked on describing steps for the use of standards within the health domain, and indicated policy actions needed to support convergence on this set of models for sharing data. So Work Package 7 published 3 reports, Population Health Data Implementation Guide, a training package, and Health Data Policy and Practice Recommendations, the latest report, which is the topic of today's presentation. And with this, I will now stop sharing and I will give the floor to Keith. And thank you all again for being here.
Thank you, Alex, and hello, everybody. And thank you very much for that introduction. I'm just going to take care of the housekeeping side of sharing my screen. This gave me some grief the last time around, but I think we should be okay now. Can you all see that? Mm-hmm. Okay, that seems to be working. I just need to try and make all of you disappear as well, because you are covering up some of my slides. Okay, so welcome to this final webinar for WorldFAIR. It's nice to see some of my LSHTM colleagues here. This is a kind of a summary of the last deliverable that we've just produced, which was looking at guidelines and recommendations from our case study on population health. And it's a kind of summation of all of the work that we've really been doing over the last 18 months or so, in terms of coming up with standardized approaches to developing standards and mechanisms that help to make data fair. And producing something that, whilst focusing on low and middle income countries, wasn't sort of something that was exclusive to them and that wasn't separate to what was taking place elsewhere, because a lot of what we're trying to achieve at the moment is harmonization across a number of different settings. And so we wanted these recommendations to be reflective of what's taking place in other environments in which WorldFAIR is operating. My slide isn't. Oh, here we go. A little bit of a brief description of the actual final deliverable itself. So specifically looking at health research in low and middle income countries, we're looking at best practice and policy recommendations to make harmonized data and harmonization processes fair. And these recommendations also suggested including a proposal for a new metric for the evaluation of fair implementation. And that is something that I will return to at the very end of the presentation. But the first thing I really wanted to look at is something quite broad, which is this idea of low and middle income countries and the areas upon which we're focusing. And I just wanted to kind of give some definition of that, because it's a term that we use a lot, and it's not always entirely clear what it's based upon. And in fact, it's focused upon a measurement of gross national income per capita. It's often a World Bank classification, and we can see here a map from data from 2015, which has carried this classification out into lower middle income, upper middle income, and high income countries. And so the distribution of that is quite clear. The actual classification of lower middle income countries is conducted by the Organization for Economic Cooperation and Development. It's revised every 3 years. Within Work Package 7, we have focused very much on Southern and Eastern Africa, and in particular in Kenya and Malawi and South Africa and Tanzania. And there are many settings that are very similar to the countries that we've worked in, to the countries in which we've generated data, and in which we have kind of worked on implementing FAIR practices. But there is a clear reason as to why our focus has been on this part of the world, and it's all to do with the origin of Work Package 7 itself. And I'm going to talk very briefly about the network that kind of is the underpinning to a lot of what we have been doing. It's the Alpha Network, which is analyzing longitudinal population-based HIV and AIDS data on Africa. And this was established nearly 20 years ago as a collaboration between 10 longitudinal population-based studies in sub-Saharan Africa. And it was a very early approach to many of the things that we're talking about now. It was about harmonizing data around HIV. It was around bringing together different data sources in a meaningful way. And it was about being able to produce more robust evidence as a result of doing that. It didn't exist within a framework of FAIR or anything else, because those things didn't exist at the time. But nevertheless, it was taking this approach. Alpha was focused on Southern and Eastern Africa. And if we look at this map of HIV prevalence, we can see why. This is a relatively recent measurement, but this has been an accurate picture for many years now of the prevalence of HIV throughout the world. And we can see that Southern and Eastern Africa have amongst the highest prevalences in the world. Now isn't the place where we can talk about that, but it does explain why Alpha existed in how it operated in the places that it does. And hence how our work with lower and middle income countries became focused upon Southern and Eastern Africa. And you can see here, I've just brought together the components of those three maps that kind of highlight those similarities. The Alpha Network, together with a number of other collaborators, formed a new network called Inspire in 2020. And Inspire acted as a hub and as a focal point for bringing together all of these data-related operations. Inspire is now largely run by the African Population and Health Research Center in Nairobi, with additional collaboration with CoData primarily, and also with SAPRIN in South Africa. And it is from Inspire that then led to the engagement and involvement within WorldFAIR. And this is why WP7 has the range and the focus that it does upon these particular settings. Now, in terms of the data that we've worked with, this has led into the conclusions that we've reached over the last year. The settings in which we're working were very specific in terms of the health data that were available to us. We were largely working with what are termed Health and Demographic Surveillance Systems, or HDSS. And these are very distinct entities. They were first established in the 1950s in response to a lack of accurate population data in many African countries. There was just not the infrastructure to generate the information that was needed to have meaningful public health interventions. And HDSS defines a clear geographical location in which an entire population is monitored for births, deaths, and migration. And these are open cohorts of people. So migration is recorded as it takes place. And these are genuinely longitudinal studies. So each individual within an HDSS is first identified during a form of a baseline measurement. And then ideally at least once a year, but as frequently as is possible, their status is traced from 1 year to the next. And this means that we were enabled to calculate incidence rates on this basis. We were able to look at periods of residence within HDSS and calculate incidence around HIV infection or mortality, or whatever it may be. So these were very distinct data collecting environments in which we were working. They bring with them a number of specific challenges that may not be faced in quite the same way in other settings. So firstly, we're working with extremely diverse IT infrastructures, with data collection platforms and data collection formats. There's very little standardization that was taking place across HDSS in different parts of Southern Africa. Often we may find ourselves working with immature or outdated infrastructures, and many sites had limited exposure to and access to FAIR-related technologies. Many of the things that we talk about now in terms of the applications that we use were not readily available in the settings that we're working in. By definition, we deal with very high volumes of individual level health data, and these are highly sensitive in many cases. And this is something that has been almost quite specific to Work Package 7, is the sensitive nature of almost all the data that we're working with, and how we have to pay very strict attention to that in all the work that we've done. We can find an absence of operating procedures and rich metadata, and an absence of relevant standardized vocabularies. And of course, there's been financial instability in these settings as well. So HDSS and other settings like them, they present us with a range of specific challenges that data generating institutions in other parts of the world are not necessarily faced with. And this isn't restricted to the parts of Africa in which we work. These are common to many of the lower middle income countries who are trying to conduct this work. With this in mind, when it came to looking at recommendations, we knew that many of the data producers who we wanted to advise may not be in a position to make very advanced steps to begin with. Often in these settings, the key thing is to collect the data and to use it on the spot. This is where the resources go, because the data is important and the decisions that are made upon it are important. And a lot of the resources can go into the data collection, which is difficult. Longitudinal studies are difficult things to conduct, and they're time consuming, and they take a lot of resources. And so it's very understandable that the documentation and metadata are not things that are the top of a priority list for an HDSS that is primarily focusing upon public health intervention. And so we firstly recommended that our data producers who didn't have experience of developing metadata would use the tools and guidance produced by the Data Documentation Initiative. And this would give exposure to producing metadata, to working with standard vocabularies, and to publishing those metadata in a format that's machine readable. And the two most commonly available versions of DDI, one is Codebook, the other is Lifecycle. Codebook is more focused upon single round surveys, longitudinal and non-longitudinal studies, whereas Lifecycle is focused upon repeated data collection. And as I'm sure you know, DDI CDI is a new iteration of DDI that is, as I understand it, currently under production at the moment. The DDI itself is an international standard for describing the primary data produced by observational methods initially in the social and economic and life sciences. It's maintained by the DDI Alliance, which is hosted in the University of Michigan. It's used by a wide variety of organizations, and it can document each stage of a research life cycle. So it's a valuable tool to use, particularly for organizations, for data producers who don't have prior exposure to doing this. And it provides a clear structure for describing research data and gives a standard that supports data sharing and reuse. So it very much points in the directions that FAIR is aspiring towards. And it's a useful introductory step for agencies who may not have had exposure to this work before. Our second recommendation, I have a now cold cup of coffee here. Our second recommendation are for those data producers who do have experience in data documentation and who have some resources to do this. And we're recommending quite specifically that they make an organizational decision to adopt what's called the Odyssey Common Data Model as a key step to making population health data fair. So to kind of get into some of the detail of that a little bit, the first question is, well, what actually is a common data model? And a generic description of that is that it's a standardized model which allows for data information and exchange between different applications and resources. So it is all about standardizing the approach in which different agencies operate. There are numerous advantages to using them. The first, from my own standpoint as an epidemiologist, is that the more you bring data together, the more that it's harmonized, the greater the data sets that you have more generalizable data as a result, and you have greater power for statistical analyses. And this was among some of the main motivations for a study like Alpha in the first place. We wanted to be able to make decisions, database decisions that were applicable in a greater range of settings and that were more robust because of the volume of data that we were using. So that's the first step, or the first advantage, if you like. We wanted to be able to share methodology and computer applications and code because of the inherent efficiency of doing that. And it's also clear that working with common data models, it substantially increases the collaboration and communication that takes place within research. Those barriers that are presented by people operating in different ways are kind of eliminated at quite an early stage if people are working within a common model. And in terms of the subsequent steps of making data fair, you have to take this preliminary step first of this standardization. Our recommendation to adopt the Odyssey model, part of that is to do with the scale and the range of the body itself. a very large number of collaborators, a very large number of engaged countries, a very developed information and support network, which is valuable to people who may be embarking on this kind of work for the first time. And it also has a specific Africa chapter, partly led by colleagues who we work with at Inspire. And that has a very distinct directive to strengthen the awareness and capacity for data harmonization and analysis. And also in particular to look at producing relevant standard vocabularies. And this is something which hasn't been explored in as much detail previously, because in many of the other areas in which Odyssey has operated, that hasn't necessarily been required. So it's looking to embrace and adapt its methodologies to these particular settings. It's also important, and I've said this previously, we are looking at overall standardization. We're not looking to do something different in lower and middle income countries that is being conducted in higher income countries. We want everybody to be able to work together, to be doing the same thing, to be adopting the same standards. And Odyssey, in terms of its scale, makes that possible to do. And so that lies at the basis of that recommendation. Their common data model, as you can imagine, the underlying premise to it, in a sense, is quite simple. It's an open community data standard. It aims to standardize the structure and content of observational data across different health research environments. And it's clear to see you can have multiple different sources of data held in different ways and in different formats. You transform them into a common model, and you can then start to work in an analytical way that is standardized. This simple diagram quite rapidly translates into one that's more complicated. And I'm not going to dwell on this for a long time, but it just emphasizes the level of detail within the common data model. It's person-centric, so everything does stem out of a person table, if you like. It does require some background and knowledge to work on the transformation of data into this particular model. Odyssey do provide a range of tools for doing this. The other thing to emphasize, particularly when talking to the funders who pay for this work, is that it is crucial that priority and emphasis is placed upon resourcing this work adequately. We all know that the electronic data environment in which we're all operating in, it's a burgeoning environment. It's growing very rapidly. It is technically challenging to keep up with, and we require specialist expertise in this area. And it's important that if these steps towards FAIR are to be successful, then funders and policymakers need to also accept that we want very dedicated members of staff who can do this. The common data model does kind of lie as the cornerstone of what it is that we want to do in terms of the standardization of the data itself, what is actually being collected on the field. One of the other key aspects of OMOP is the use of standardized vocabularies. And this makes complete sense in terms of wanting to make the holding of data as standard as possible. You wish to use common naming and classification systems for medical terminology. And there are a number of standardized vocabularies that some of you may already be familiar with. But clearly the aim is to reduce ambiguity in medical terms, which there is an almost limitless capability of happening. It increases efficiency in recording information, and it reduces the likelihood of errors. The OMOP standardized vocabularies, they act as a common repository for all of the vocabularies that are being used within the Odyssey community. and they're all standardized to the same format. And if I go back to this diagram of the common data model, you can see how central they are to the structure of the common data model itself. And they are, as you can see, they're a kind of a mandatory reference table, so they must be used when restructuring source data into the CDM. As I said, Odyssey provide a range of tools for structuring data into a common data model format, to analyzing the data, and they also provide this repository of vocabularies termed Athena, which enables the identification of vocabularies and other classifications that are already in use. So these, in a sense, are sort of some of the initial steps in terms of standardization. They're quite long and complex tasks to carry out, but they are fundamental to what then happens next in terms of making data fair. And what we move on to from that point is then what I'm terming our third recommendation, which is about metadata and machine readable metadata. And there are three components to this recommendation. The first is that data producers produce this machine readable metadata, that they use a standard called schema.org, and that within that standard, a coding application called JSON-LD is used to create these metadata structures. And I'll say a little bit about each of these points. I'm not going to dive too much into the technicality around all of these things, but there are some kind of fundamental principles. So when we talk about machine readable metadata, we're talking about metadata that's been written using standardized formats and vocabularies that can be readily identified and indexed and returned by internet search engines. This indexing and identification is not relying upon any kind of human input. The metadata is written in a way that the search engines can identify it and reveal it and display the key features of it without any kind of human intervention. And when we're talking about working at scale, which we all are, this level of automation is required. So this is what we mean by the machine readable part of it. When we talk about schema.org, this is a collaboration that was first established nearly 13 years ago between some of the major internet search engine companies. So this, in a sense, is their own approach to standardizing how the internet is actually used. And it kind of partially explains why when you search the internet, the detail and the nature of the results that you get are becoming more and more detailed each time. Its principal aim was to develop and expand these standardized coding structures for metadata. And these are added to the programming of web pages. So they're embedded within web pages, and they are doing the work of identifying metadata and identifying the sources of data. And it then also improves how the search engines understand and display content. And in terms of carrying this work out, again, a recommended application for doing this, the acronym is JSON-LD. It stands for JavaScript Object Notation for Linked Data. It's been recommended by Google for creating structured metadata. And it is able to embed this metadata information into web pages so that it's hidden from human users, but it is visible to computer search engines. So we don't necessarily see these information, but the search engines do, and they can identify it and they can display it. And if we write our metadata following these standards, then the revealing of those metadata to other people who may be interested is much more likely. And so in terms of the findability aspect for sure of FAIR, these kind of steps are important. And JSON-LD helps to fulfill our FAIR objectives in the following ways, because as I was just saying, in terms of findability, it allows data publishers to embed this rich metadata into their web pages so they can easily be discovered by search engines and by other machine-based operations. It's lightweight and it's a human-readable format, so it's easy for both humans and machines to access and to process. It uses the standard vocabularies and ontologies that I've been talking about, so the integration of data across different sources and across different domains is much more likely as a result of taking these steps. And I've talked a little bit about interoperability within the health domain. Some of the original work that Alpha was doing was bringing these different data sources together in a way that was meaningful. FAIR is also very much emphasizing the interoperability of data across different domains. And so the standardization of these approaches makes that possible. And even though population health data, it seems quite an enclosed methodological environment, if you like, but when we think about its intersection with issues around climate change, with issues around other forms of hazard, the impact and the implications upon health mean that we are looking more and more at trying to achieve cross-domain interoperability. We are not ever really looking at health in isolation from the factors that are contributing towards it. JSON-LD is also reusable in that it provides these clear and concise descriptions of data so that it makes it easy to reuse this methodology in new and innovative ways. So in terms of the application of FAIR to metadata and to rich metadata, working with these standards and with these applications is a core recommendation that we're making. And again, these are things which require quite specific resourcing in order to make work for them to be efficient and effective. Moving on from that, a fourth recommendation takes us a step further beyond that. I've talked so far about machine readability of metadata, but there is also the step of machine sort of actionability, of the extent to which non-human intervention can enable research projects to some degree or another to be conducted. And this is sort of at the other end of the spectrum of experience and expertise, if you like, in terms of being able to carry these things out. What we're recommending here is that data producers who have experience of using the common data model, of working with schema.org and with working with JSON-LD, use these tools to develop what we're calling study packages that incorporate study designs and cohort definitions within them. And essentially, what a study package is, it's a catalog of metadata that can be shared between data producers and that give the full instructions on how a specific research project should be carried out. So it's a very, very detailed template of a particular research objective. And it requires data producers to be able to fulfill the requirements of that template. It needs to have data present in the correct structures in order for this to work. But it does mean that certainly in theory, organizations, you have similar data structures, similar objectives in terms of research or in terms of utility. They can use these to conduct analyses and to generate aggregate results that can be shared. And one of the reasons that this is increasingly important goes back to what I was saying about the nature of the data that we work with, the sensitive nature of it, and the highly diminishing ability for data producers to be able to share their source data directly with one another. And increasingly, there are directives and ministries of health who do not permit data to leave very, very secure environments in which they are stored or where they are generated. So what we were able to do 20 years ago in terms of sharing anonymized data with institutions such as the LSHTM, that's much less of an option now. The approach now is that the template for the search is written, and that it is then sent to the data producers. Those templates are used by the producers on their own data, and the data don't leave the point at which they're at the most secure. We have examples of this in the UK with our NHS data and a very, very robust, trusted research environment in which you may never see the data that you're working with. And you submit queries to the data, you get responses back, but you have no contact with any of the individual level data. And this, you may come across the term of federated analyses, and this is essentially, I think, what we're talking about, the data that remain where they have been created. And so with these structures in place, you can share the design and execution of a study between those who wish to desire to contribute towards that. And leading on from this, in terms of technical capability, we talk about metadata being both readable and actionable by machines. So ideally, rather than metadata just being understood by search engines, it is feasible that a metadata description could be assessed alongside the contents of the common data model to determine the extent to which an analysis can take place. And as I said, this is an advanced place to be technically, but it is approach is also common outside of the health domain. And again, it enables interoperability across domains to become more possible. And for these reasons, the combination of schema.org and JSON-LD, as I understand it, has been recommended by the WorldFAIR, the cross-domain interoperability framework, which I believe was presenting its final documentation last week. Okay, the fifth recommendation, one which many of you will be familiar with, is the deployment of FAIR implementation profiles. And this is something that is very specific to the FAIR environment. It's a summary of the choices that a specific organization has made in order to implement each aspect of their FAIR principles. It's organized as a set of questions. It asks data producers to detail the practical steps that have been taken to achieve each FAIR principle. And for each principle, there's a corresponding resource, a FAIR enabling resource that makes it possible to implement that principle. And there's a simple but quite slightly fuzzy spreadsheet here that details the question that's applied to each of the FAIR principles and the subsets of the principles that exist. In terms of being specific about the resources that you intend to use in order to comply with each of these FAIR steps. And there is also a developed online application for doing this. It's termed the FIP Wizard. It enables users to document their FAIR enabling resources and how these meet the FAIR principles. It also enables them to produce what are termed nano publications of these resources. So it's a saved identification and description of a particular resource and how it actually works. And again, these can be shared within that environment. And there's just an example here of one of the resources that has been selected in producing a FIP for some of the work that we've conducted within Inspire. And finally, our final recommendation, which in fact isn't a recommendation, the initial description of the deliverable that we've just produced included the concept of producing a further metric tool for measuring FAIR achievement and FAIR implementation. And again, this is an area of growth of software that are able to identify the steps that individual agencies have taken to achieving the FAIR principles. But being mindful of the environments that Work Package 7 has focused upon, and mindful of the processes that we're describing here, the working group is not proposing developing an additional metric tool at this stage. Instead, it is recommending that data producers in low and middle income countries adopt those recommendations presented here as is appropriate to their stage of data documentation, and to assess their FAIR attainment by drafting a FAIR implementation profile. Now, that isn't to say that the metrics won't continue to expand, they won't become more refined, and it isn't to say that they don't have value as tools, as a utility that can play a valuable role in providing a snapshot of the attainment of FAIR by an individual agency. And it may enable some comparison of FAIR attainment across agencies. But I'm hoping that one of the things that's become clear from what I've been saying is that attaining FAIR principles, it's a very detailed, it's a very iterative, and it's a highly individual process for a data producer. And many of the data producing agencies who we are working with and we are hoping to make recommendations to are at a relatively early stage of this process. It takes time and it takes resources to implement, but we feel that a combination of the recommendations here and the template of the FAIR implementation profile enables data producers to assess for themselves the extent to which their movement towards FAIR is taking place. Okay, that's a whistle-stop tour of the deliverable that was published at the end of last week. As Alex was saying, these are the closing moments of WorldFAIR. For the work of Work Package 7 and for some of the individuals who are involved in that, there are further steps that are leading in this direction. One of which is this blueprint for African population cohorts consortium, which I believe was launched this week in South Africa, which again is adopting and embracing a number of the techniques that we've been talking about here, but across a much broader scale across the continent than the work of Inspire has done so far. And also a new grant, a new research project that has come into existence in the last 3 months or so, Data Science Without Borders, which again involves Inspire, CoData, the Turing Institute, a number of other collaborators, and data agencies now in Eastern, but also Western Africa as well. So an expansion geographically and an expansion technically in terms of what is taking place across the continent, with the view that the adoption of FAIR principles in lower middle income countries are in no way a compromised version of what is happening everywhere else. We're applying the same methodologies across the board so that true interoperability and harmonization is possible as a result of that. Okay, that's everything. Thank you very much. I shall stop sharing now.
Thank you, Keith. Thank you for the great presentation. And at this point, we are going to give the floor to our attendees. Would anyone like to ask any questions for Keith? I see we have Jim as well in the room, the other work package lead for this case study. So I see Simon is adding some comments. Oh, Jim, you have your hand up, please.
Yeah, thanks, Alex. Just wanted to say, yes, I think what with this and producing these very structured and very simple and very realistic recommendations has been very helpful to, as he pointed out in his penultimate or last slide or whatever it was, the development of the ideas of how population health cohorts, how the whole collection of these data from various places across Africa can be made much more available to other people, so that eventually we will have fair data from population health sources across Africa. And I think what was missing, and what WorldFAIR and in particular Keith's work with these recommendations has done, is made it into a series of steps, which I think most of the cohorts can follow, because they are using methods and which this is the necessary step to make things into something which we can use ourselves without too much technical difficulty. Thank you. Thank you, Keith.
Go, Alex, you're on mute.
Yes, thank you. Would anyone else like to unmute and raise their hand? Amy, please.
Yes, also, thank you very much for this presentation. I taught a course this past semester for undergraduate students, and I would really love to be able to take this content and work it into an instruction session for students who are not yet even aware of the concept of FAIR data, may never get there in terms of what they want to do, but just to plant that seed. Are there any resources that you could advise, or any plans to make a version for educational materials? I know your target may be, the people collecting the data and things like that, but like just to get to those people before they even become, informed scientists and things like that.
You're clearly welcome to help yourself to anything that we've said and published around this. In terms of resources that are aimed specifically at education, the second deliverable for WP7 was a series of training videos. There are 7 videos that explained the kind of data pipeline from taking raw data from a WHO source through to producing the rich metadata that comes out of that. That is aimed at data producers, but it may still well be relevant to the student population that you're talking about in terms of an introduction to that. I'm not aware of other kind of teaching resources, although I am aware that we're looking to develop similar teaching ourselves within our own health data science MSc here at the school. But that's in a very novel stage at the moment. But if there's anything either here in the presentation or in the slide set or in the deliverable, then feel free to use that. I'm certain we all view those as very publicly available resources. And also, just Simon asked a side question earlier on around the involvement of countries in the Alpha network. And maybe it's more of a question for Jim, because Jim has been involved in Alpha for much longer than I was. I assume it was to do with the presence of the HDSS sites that Alpha relied upon in order to work, and the development of those sites and the collecting of HIV-related data. I imagine that those are the key reasons as to why those countries were not included. Data collection around HIV is very variable between countries. Some places like Uganda have been collecting it for 30 years. Others much more recently. It's to do partly with the capability to do so. But Jim, I don't know if you want to add to that.
Yes, that's exactly right. And that we identified 10 reports which had the necessary data to be used for HIV population health assessment, and that was suitable for building the kind of shared harmonized data sets that were used at that time. But it meant that some countries where there was a high level of HIV, some of them didn't have that data, so they couldn't be, the data couldn't be shared because they didn't have it. So I think you're exactly right there, Keith.
Okay, good.
It does emphasize the need for every country to have population cohorts and other cohorts which will be able to create the data sets. Yeah.
Thank you. Any other questions from our attendees? We have about 5 minutes left. No more questions? Okay. So in this case, I think we can give everyone 5 minutes of their day back, and please check the chat for more information on the various things that have come up in conversation. We will include them in the email that will go out to our registered attendees after this meeting. Links to our Zenodo community and the WorldFAIR website are also in the chat and will be distributed. And as Simon said in the beginning, this is the end of the WorldFAIR project as a European Commission funded project, which finishes at the end of May. However, there are other co-data-led initiatives that are about to start to continue the legacy of the WorldFAIR project. And one of them is WorldFAIR Plus. More information is going to be on our website very soon, and you will hear from CodeData as well on that. So with that, I will thank you once again for being here, and I will also stop the recording. Thank you.